Have you ever got a surgery done? Or are you planning to get a surgery done? Any surgery, major or a minor, getting under a knife, If yes, this video is for you. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more and we'll be talking everything about good health and everything good about health. Now, why is it important to be medically fit before surgery? And what exactly as physicians we observe in a patient, and what tests and what details we want to declare a patient as medically or physically fit before getting a surgery done. We'll be talking everything and all about this in detail in the few next moments. So don't skip the video and watch the video till the end. So first things first, why is it important to be medically fit before surgery? There are two main reasons. The first one is to avoid intraoperative complications. That means those complications that may occur during surgery. And the second is to avoid post-operative complications, that is those complications that may occur after surgery. I had one of my patients who was a 40-year-old male, and he was referred by a general surgeon for hernia surgery, and for that patient needed a preoperative fitness. Now that patient had an uncontrolled diabetes, that was a recently diagnosed diabetes, and that patient had an uncontrolled one. So what do you think? Should we go for surgery or not? Ideally, that patient should not be operated. Reason being, uncontrolled diabetes can significantly alter the outcomes of surgeries, major surgeries especially. Also, the healing of the surgical scar may get complicated and may be delayed quite late as compared to the general population. So the ideal thing is to wait for at least a month or two, especially for elective surgeries, where we can control these metabolic disorders, where we can control his sugar, and once the sugar is streamlined, then patient can get operated. And this patient took medications for diabetes for a month, his sugar was under control, and his surgery went absolutely fine. And presently, he is recovering just like any other man. On the other hand, I had a 50-year-old male patient, and he was about to be operated for intestinal perforation, and I was called up for preoperative evaluation of that patient. Now, that patient had uncontrolled diabetes, that patient had uncontrolled hypothyroidism, he also had high cholesterol, that is dyslipidemia, and still I told the surgeons to go ahead for surgery. Reason being, intestinal perforation is a surgical emergency. That's a fatal condition if not treated and if not surgically treated. So surgery is must for such patients. So it's very important for us to know that what indication are we treating, like what is the cause, like what is the purpose for which we are getting the surgery done. If that's an emergency surgery, there is no major contraindication for a life-saving surgery. Whereas we have a list of such indications where we should postpone surgery or we should strictly avoid surgeries if the surgery is not a life-saving one. And in this case, intestinal perforation was a life-threatening condition, and hence that patient was operated, but we can be more cautious and we can be extra careful post-surgery for such patients, especially because we are dealing with comorbid conditions that could significantly complicate the outcomes of such surgeries. So the point is, what exactly is important to decide whether a patient is medically fit for surgery or not? Also, I would like to comment here that a patient's physical fitness is not as important as far as a medical fitness for surgery is concerned. An 80-year-old male patient could be fit for surgery, whereas a 40-year-old patient may not be fit for surgery. So here is the rule for any major surgeries. The rule is cardiorespiratory fitness. That means the heart and lung function should be normal or near normal for a major surgery to go smooth. And if that is not the case, either the surgery can be done with a high risk consent or the surgery should be delayed, or it should be completely avoided. So here's the list of things, the list of tests that are important before going for a major surgery. Starting with the first one, complete blood count, that includes hemoglobin, a urine routine test. Third one is a random blood sugar. Fourth one is a serum creat or a kidney function test. Fifth one is a SGPT or a liver function test. Sixth one is a blood clotting or bleeding time, that decides what time the patient's blood takes to clot completely. Seventh one is a cardiogram. Eighth one is a chest x-ray. Ninth one is electrolytes, that means sodium and potassium levels. And the last one is HIV and HbA1c. If all of these tests are normal, you are good to go with the major surgery. Also, one more important thing, getting a surgery done is a stressful condition, and hence while getting evaluated for surgery, especially for a pre-op evaluation or a operative evaluation, patient's blood pressure might shoot up, and if that blood pressure stays high for a long time, that indicates a control of blood pressure with antihypertensive medications. But if that is temporary, there is no specific need for blood pressure medications. Also, if a patient is already taking an antihypertensive medication, if the patient is already a known case of high blood pressure, that patient should not stop their antihypertensive treatment, and the dose needs to be adjusted by the physician during and after surgery according to the readings of blood pressure. So, I'm pretty sure almost all of your questions and doubts about preoperative fitness for surgeries are now clear. I am Dr. Jay Mehta, a consultant physician and diabetologist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do share your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.